I'm Joe McGovern, VP of Strategy, Everything Health. And I help companies with all sorts of consumer healthcare challenges, including prescription to over-the-counter switches, which are the biggest single challenges in the consumer healthcare market at the moment.
And I'm Mary Alice Lawless. I'm Managing Director and President of Everything Health. And as Joe says, we work with consumer healthcare leadership to really advance the industry as an important and contributing part of the healthcare economy. I think starting with the opening panel, which was intended to be a big gloves-off session to talk about our new administration. Obviously, when we were planning the conference, that was a really, sort of recent occurrence and took a lot of folks by surprise. Interestingly, I think our conclusion coming out of the conference and out of the panel discussion is that the Trump administration, perhaps not intentionally, but inherently, is pro-consumer. I mean, the administration wants to see more consumer choice, more consumer empowerment, wants to see costs driven down in ways that perhaps are not the conventional ways, obviously. I mean, there are some very significant and expensive healthcare interventions, procedures, and so on that can be addressed. But more importantly, perhaps, is what can be addressed to make self-care more available to the American consumer.
There's never been a better time for consumer health care. We've got an aging population. We've got rocketing costs. The cost of insuring a family of 4, we heard on the panel, was the same as buying a good car every year. Chronic diseases are rising, diabetes and heart disease particularly. So all those things lead to increasing costs and a great burden on the healthcare system, while we also have a shortage of doctors. Now, that should be the perfect environment for growing self-care, and this government may be a really good enabler for self-care. So the time is right, and people now have the chance to take leadership and do something very significant in the self-care space.
One of the things, if I can just add on to that for a second, one of the things we talked about is that we had a new piece of legislation which was signed by the previous administration at the end of last year. Interestingly, in that is, sort of the stimulus for a lot of innovation, which specifically is being applied in consumer healthcare now. We had the, Digital Health Innovation Plan announced by Commissioner Gottlieb at FDA, which is really about empowering consumers. So again, perhaps the real parties who can act on this and make a difference with health policy change is the consumer healthcare industry.
It's interesting to see the head of FDA being a strong leader, setting out his agenda and making his first meeting outside the FDA with the Consumer Healthcare Products Association. That is a big, strong signal that self-care is really important.